today I'm going to talk a little bit about a tuberculosis outbreak that's been reported in the San Francisco area centered on a school. So, what we know is that there have been three active cases of tuberculosis identified there and 50 latent cases. And I've done videos about tuberculosis before, but what this means is that there are three people that are actively contagious that were found at the school. And as part of that outbreak, 50 people have been infected with tuberculosis, but it's not causing active symptoms at this time. What that's led to is a major public health investigation at the school, including suspension of classes and a lot of case finding. What their goal is to first find anybody else that might have active tuberculosis that's contagious to other people. Secondly, it's to figure out any more latent cases, which are people who may in the future reactivate, but who could be prevented from reactivating if they are put on treatment. So, what I think likely happened is that there was a case of tuberculosis that went undiagnosed. Maybe it was a latent case that reactivated in an immunocompromised person or someone who developed it just by happenstance, and it spread within the school system, infecting multiple people, including some that converted into active tuberculosis. So remember, latent tuberculosis is when the bacteria is basically sort of clinically dormant in your body. It's there. You will test positive on a skin test. You will test positive with a certain type of blood test, but it's not causing any major problem with you. Active tuberculosis is when the bacteria is much more active. Your immune system is fighting it. You might have symptoms like cough, fevers, chills, weight loss. And when you cough, you are emitting that bacteria, which can infect other individuals. So the issue now is to make sure that there's not any more active cases and to understand the root causes of how this outbreak occurred. Because this isn't something that's very common, but it does occur. And it is going to take a major amount of resources and efforts from the public health community there to put an end to it and end the new cases from occurring. But it is something that's somewhat unusual to see a high school-based outbreak of tuberculosis, but that just is a reminder that this is still the number one infectious disease killer in the world, that it is highly prevalent, and we still have around 10,000 cases every year occurring in the United States, and San Francisco has about 100 occurring per year. So we're not completely resilient to tuberculosis outbreaks, and it does require a lot of public health effort to keep tuberculosis